Hi, my name is Heather Condon. I'm a clinician at Project Courage in Old Saybrook. Today I'm going to be talking about preventing prescription drug and opiate misuse. So the National Institute of Drug Abuse defines the following factors as misuse of prescription drugs. So taking prescriptions greater or more often than prescribed, use of someone else's prescription, taking the medication to feel a euphoric effect. In 2017, NIDA research study concluded that opiates were related to over 40,000 overdose deaths. And in 2019, the National Survey of Drug Use and Health collected data stating that approximately 9.7 million people misused prescription medications within the last year. So there are a number of ways to help prevent prescription drug and opiate misuse. So one is called the Prescription Drug Monitoring Program. This is a database for healthcare providers to track prescriptions and identify misuse or kind of identify who is at risk of an overdose. There's also insurance programs that require healthcare providers to request prior authorization, have constant utilization reviews during the time that they're prescribed that medication, and it also limits the quantity of prescriptions. Healthcare providers are also educated and around prescribing guidelines, how to explore conversations with individuals, safe storage, and disposal. So things that you can do to prevent prescription drug and opiate misuse. So not only can the doctor start a conversation, you can have an open conversation with your doctor, your dentist, your veterinarian on ways of pain management. So you can discuss different options of pain management, side effects, and concerns that you can make an informed decision. Following up with your doctor to check in and also explore changes after that medication is received. So again, take medication as prescribed by your doctor. Avoid combining opiates with alcohol or other substances or medications. Combining the substances can be extremely dangerous. I can't stress that enough. A drug that produces changes in mood and distorts perception is considered a psychoactive substance. And drugs are typically classified into two categories, a stimulant and a depressant. So a stimulant sends the central nervous system into overdrive. It increases heart rate, breathing rates, suppresses appetite, increases blood pressure. So some examples of stimulants are caffeine, nicotine, cocaine, Adderall medication, things like that for ADHD. And depressants work by inhibiting the central nervous system. So they slow down the heart rate, respiratory, gastrointestinal systems. So examples of that are alcohol, heroin, opiates, codeine, and fentanyl, and benzodiazepine medications. So things that are typically prescribed for anxiety symptoms. So stimulants and depressants are basically on polar opposite ends of the drug spectrum. So the body receives mixed messages when and can go into shock when someone takes a stimulant and a depressant at the same time, or when someone takes two types of depressants. So opiates are a depressant. During an overdose, breathing is slowed and can stop and can cause brain damage or death. So it's important to be aware of signs and symptoms of an opiate overdose. The following signs and symptoms have been identified by the CDC. So if someone has small or constricted pupils, is falling asleep and unable to stay awake to the point of like a loss of consciousness, slow or shallow breathing, choking or gurgling sounds from the throat, limpness in their body, pale, blue, or even cold skin. So if you think that someone's having an overdose, or even if you're unsure, you can save their life. Immediately call 911. If you have been trained or have access to Narcan, administer it, or have someone in your building administer it who's trained. Narcan is also known as naloxone, which is an opiate antagonist. It blocks the receptors in the brain and rapidly reverses symptoms of an overdose. So due to the opiate epidemic, many first responders and healthcare professionals have access to this, but you can also make a difference by preventing an overdose by getting trained and more education around that as well. Also make sure to keep the person awake so that they're breathing. You can position the person on their side to prevent any choking, and stay with the individual until the first responders arrive. Some additional prevention strategies: do not share or sell your prescription drugs. Store prescriptions in a secure place and out of reach of family members and visitors. So you can also do that by buying a lockbox. If you have any unused prescriptions at the end of your treatment, you can turn your medication in at a drug take-back program. Some local pharmacies have a mailbox program, and police stations do as well. Or you can order an activated charcoal bag for in-home disposal. This method is safer for the environment rather than flushing the medication. So just recapping, what you can do to prevent prescription drug and opiate misuse is talk with your doctor, your dentist, and your veterinarian on ways to manage pain. Store medication in a safe place and away from family members or other visitors who you might have in your house. Safely dispose of medication at a drug take-back event, pharmacy program, at certain law enforcement locations, or through an activated charcoal bag, and become Narcan trained, and also just continue learning about risks of prescription drug and opiate misuse. Thank you.